We get this question a lot, and it usually comes from family members of elderly parents, or somehow connected to an older adult who's living at home, either with their spouse or alone. And they ask us, how do we know if my loved one would benefit or may need physical therapy? And how do we get involved with getting you guys to come and use your in-home physical therapy program to work with that person? So a few things here about the individual, the elderly individual living at home alone or with their spouse who is also obviously elder, is sometimes you can find that their confidence in their moving around their own home or in the community is causing decreased activity. If you notice that your loved one is moving around the house less, maybe there's a little more clutter, maybe there's things that they're used to taking care of that is being pushed to the wayside. They're not going up and down the stairs regularly or as often as they had, and maybe they're just sitting more often, and they just don't have that confidence to be able to move around. There's something going on there that is causing that, and it's usually just a lack of activity that's causing your system to kind of depress itself, and it weakens, and your endurance is lost a little bit, and perhaps your balance is affected in the same way because you don't get the movement that's necessary for those systems to continue to practice. So that's one. If you see, your loved one, having some difficulty with confidence that leads to decreased activity. If you see your loved one having an increased level of difficulty with taking care of themselves, doing household things such as cleaning, laundry, cooking, ADLs such as bathing and those types of things, and toileting, all those things, if they're slowly declining, they can be reversed. A lot of people unfortunately think that because somebody's getting older, it's inevitable that they're going to get weak and lose their balance and move in that direction. That is 100% not true. So if you see anybody who is having more and more difficulty with those things, that would trigger me to want to check into how they can be helped with physical therapy in the home. Our big one is falls. If your loved one has fallen one time, that's it. Okay? If you see them losing their balance and they haven't fallen, you got to get in touch with us. If they've fallen one time, you have no choice, because the number one thing that predicts that a person is going to fall in the future is the first fall. It will always happen. Balance will not improve by itself, but it will improve with the right physical therapy team. And we work a ton with older people with balance problems, and it works. It really does work. So if your elderly loved one is having balance issues or falls, do not hesitate at all. It can only benefit them. There's nothing that our program could do to hurt them at that point. It would only be a benefit. Certainly, older folks with persistent pain or worsening pain, physical therapy is a great choice for that. If they are recovering from surgery or there's a surgery planned, an elective surgery, such as a knee, hip, or a shoulder replacement, or any kind of simple surgery that has them in the hospital for a few days. Even those little types of things can take its toll, and the doctor, may just let them kind of recover on their own, but therapy might be a good option to kind of boost that recovery. And lastly, if anybody is hearing that your loved one or your elder mom or father is having dizziness or a spinning sensation, certainly that's at the top of the list as well, and we can kind of take care of those things and move the patient away from that sensation so that they're more safe. So a lot of considerations when people get older. The fact is, older adults don't get weak and dizzy and off balance because they're older. There's usually a reason for that. We find it's often associated with decreased activity. So I want you to get in touch with us as soon as possible if that's the case, even just to ask questions. Reach out, and we'd be glad to help in any way that we possibly can. This is Joel with our Achieva Rehabilitation in-home physical therapy program, and pass this along if you know anybody who may have mentioned that they're worried about their parent or their elderly loved one.